Hello, everybody. This is Dr. Dan Carlicchio. I want to welcome everybody to Destination Health Podcast, where we find function in a dysfunctional world. It's powered by Suburban Wellness Group. We have a very special guest for us here today, and we are very happy that she accepted to being a guest, Dr. Jen Haley. Dr. Jen, how are you today?
I'm great. I'm so happy to be here. So excited.
Yeah, we're going to have a good time. We're going to motivate, we're going to educate, and we are going to inspire. So, a little bit about Dr. Jen. Everybody sit down, relax. I know when I read the bios, we want to get through the bio. It's all good. BS in nutrition and biology from Cornell. She went to medical school at the F. Edward Herbert School of Medicine in Bethesda, Maryland. Too many honors and citations to even mention. Board-Certified Dermatologist since 2004, scored in the top 1% on the in-service examination during all 3 years of dermatology residency. I don't think I can do that. After completing her residency, officer in the United States Navy, thank you very much for your service, selected VIP dermatologist consultant to the U.S. Capitol in Washington, D.C. Since 2009, private practice using her extensive international experience in medical, cosmetic, and surgical dermatology. Dr. Haley, thank you very much for being on. How are you today?
I'm good. You're making me feel old here, but yeah, I'm good. Good
That's
energy,
okay.
ready to go.
That's okay. If I'm ever on your podcast and you read my bio, it'll, you look at me and say, geez, you're old. And it's not just because of the snow on the top of the head. So let's start off with why dermatology? What was your interest in such?
Oh gosh, it wasn't actually. So I went to Cornell because they have a great vet school and I wanted to be a veterinarian. And after working on the farm a few times, I realized it wasn't about playing with dogs. So that wasn't quite the path. So
Right.
then I switched to pre-med and my goal was to be a pediatrician. And when I do something clearly, I'm very gung ho. So I was peds everything and
Uh-huh.
president of the Peds Society. Everything about me was peds. If someone asked in medical school about pediatrics, they'd say, go talk to Jen. She's peds, 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 right? A little
Mm-hmm.
obsessive about it. So ironically, I was on a pediatric rotation, and one afternoon on a Friday, they said, we need to spend time in a specialty clinic. And the choices were cardiology or dermatology. And I didn't like cardiology very much. I still can't read an EKG to this day. I've never been able to read one. And I'm just not a tech person. We were talking about this earlier.
Yeah.
And I'm just a people kind of touchy person. So I said, fine, I'll do dermatology. It'll be an easy afternoon. It's not like a real doctor anyway. That was my thought, right?
Oh, gee. And now for all the dermatologists that are out there, Dr. Jen is a dermatologist. She didn't really mean that.
Well, I thought that in my head. I would never say that out
Right,
loud, right?
right,
But I
right,
said,
right,
fine,
right.
I'll go and do it. I had no idea what it was. So I went and I spent a half a day in the clinic and I was just amazed, like
Really.
just mouth open, just amazed. I mean, I love the fact that you can go from room to room and see someone with acne, and then you can do surgery, and then you can
Mhm,
remove something on someone's face and you get immediate gratification. They're happy about it.
mhm.
And I love the fact that then lasers were like really up and growing back then. So there was a lot of growth in the field.
Mhm.
And I love the fact that you can look at someone's skin and it's an indicator to what's going on inside the body. It's not just skin. The skin is the largest organ and it's
Yes.
representing what's inside. That was the beauty of it for me. And I was sold after that. So, of course, I had to rearrange my schedule again and
So
proceed on
now,
a different path.
so now you had to go onto a different path. Dermatology became your passion. I think I would have gone for cardiology because I like that stuff. I know how to read an EKG, not very well, but I can definitely read it.
I
So
know who to
from
call.
so from there, tell us about the Navy. What happened with that?
Yeah. So all of these things are very serendipitous for me. And I'm such a planner. I like to have a plan, but I rarely follow the plan. And I follow my intuition and my instincts when something happens, right? I believe in, the universe has a plan for us and you have to be open to creative possibilities, right? So I went to Cornell undergrad. I'd get really bad seasonal affective disorder, so bad that my house was the first house in college town. And I couldn't even get out of my house to go next door to the next building to go out to dinner. Like that's how lack of energy and lethargy and exhaustion and depression I had from that. Looking back, it was probably a vitamin D deficiency.
Right,
Um,
right.
with what we know now, right? But
Sure.
But I was convinced that I needed to have some sun. The sun provides us beautiful energy. It gives energy and photosynthesis to the plants. It does that for us as well.
Mhm.
And I wanted to be around the sun. So I basically drew a line across the United States, Maryland and South, and I applied to all the medical schools that I could. The thing about medical school, and I don't know if it's like this with chiropractor school, but if you don't live in state, it's hard to get in. So, any of the UC schools or University of Arizona, like any of the state
Right.
schools, if you're not a resident, it's a less than 1% chance. And as a poor
Yes.
college student, I didn't really want to waste my $40 application fee if I wasn't going to get in. Right? So I applied to, I think it ended up being Emory, Tulane. I moved out to Arizona at that time to get residency, U of A, and then I applied to this F. Edward A. Bear School of Medicine. I didn't know what it was. It was in Bethesda, Maryland. And I called them up on the phone. I said, "Do you accept out of state residents?" They said, "Sure." I checked the box. I applied. It was free. And I get a package back really thick. It was about 6 inches thick, asking for security clearance, fingerprints, talking about diving and flying and traveling. And I realized it was the military. So I accidentally applied to the military medical school. I didn't realize there was
Really?
even a military medical school. I didn't know anything about the military. My
Right.
dad was in Vietnam when, before I was born, my dad was in Vietnam, but I didn't really know much about the military. And it was free, and I said, why not? And then I went there and I fell in love with it because, unlike traditional colleges that are super competitive where people work on their own, I saw collaboration. So it was
Hmm.
a school where a lot of people would go for second careers. Like we
Right.
had previous people, and they knew they had real world experience, which I hadn't
Hmm.
been exposed to, and collaborating with other people and, working together as teams and coming up with ideas in groups. And that kind of sold me on it. And I had no idea what I was getting into, but I loved it. It was a great ride.
So next thing you know it, you're in the United States Navy.
Yeah, they gave you a choice of where you want, if you want Air Force, Navy, Army, or Public Health Service. And I didn't know, like I said, I didn't know anything. I always wanted to live in San Diego. I knew the Navy was located in San Diego, so I chose Navy. And
It's
it
it's
worked.
it's warm. It's warm there. There's little vitamin D deficiency going on there, Dr. Jen. That's for sure. So
Yeah.
tell us one other question about your bio. VIP dermatologist consultant for the U.S. Capitol. Tell us about your time with that.
Yeah. Well, it sounds really competitive and difficult to get, but I can tell you the true story. I delivered my son 2 days after I delivered my son. I got a call saying I was going to get promoted to take that position.
Oh, Jesus.
Yeah. So I have to say yes. In DC, the answer is yes. And it was great. I loved it. It was a really good experience. It was very eye-opening to me because I was a workaholic before that. And the cool thing about our jobs is we get to see people in a vulnerable state. And I think of that as such a privilege because no matter who you are on the outside of the world, and whether you're famous or a celebrity or a politician, like you're still a human being once the door closes inside the office.
Right,
And
right, right.
yeah, and I think that's just such a privilege and honor to be able to take care of people at that time when they're vulnerable. And I learned a lot about my patients, and some of the patients, obviously, I can't say any names, and some of
Of
them have
course.
passed, but they're in history books, but they may have struggled on their personal side, with their relationships and their marriages and their children being alienated to them because of the sacrifices that they had to make in order to have such successful careers. So it gave me a little bit of insight, and I reflected on my own life and tried to make a decision of what I wanted to do. Did I want to continue to be a workaholic, or did I want to start giving focus and energy towards my children and my family? So it changed my path again, just having those
Totally,
relationships
totally
form.
different, trajectory on where you were going at that point.
Exactly, exactly. But I serve those who serve. I'm not political. I wasn't involved. I usually had the I usually had the wrong TV station on for the senators and congressmen. You know? But I like the fact that like I'm not caught up in that because I'm just very unbiased once the door closes.
Right,
And
right, right. Well,
yeah,
I want to say thank you for your service. I think that's very important today,
thank you.
because I think that's in part missing. So I think it's very important. So now dermatology becomes your passion. What's your favorite part about dermatology?
Oh, wow. There's so many things. I'd have to say, as a doctor, we all have these little power things that we have. And one of the things that I really like is that I can give someone immediate gratification. So if they
Mhm.
don't like something, I could take it off and it's like, wow, right
Right.
away. Right. Sort of like you, like
Right.
if someone comes in and, they have an issue, you can make them feel better right away.
Yeah, usually we can have them feel better right away. Absolutely. Now, where does nutrition come in with the skin? You
Yeah.
have, you got your bachelor's in biology and nutrition, and now you're a dermatologist. Tell me, nutrition and skin.
Yeah, so I've always had an affinity for nutrition and health, and
Hmm.
I grew up, from very humble backgrounds, and I don't think I even had like a fresh vegetable until I was in my 20s. I look back and
Really?
I had, yeah, I had canned peas, maybe some fresh tomatoes or iceberg lettuce, but not a very good diet, just a very, very
So you
sad
so
diet.
so you grew up in the 70s then?
Yep, in the 70s, and my
Yeah.
parents were, they worked as hard as they can to get out of working class to middle class, and yeah, they bought what they could afford. They trusted that what was on the shelves was healthy, right?
Right,
Because
right,
we know it's not.
100%. Well, during that time, that's when nutrition kind of changed, and there was a lot of processed foods, and those foods just weren't really so good for you. So when you look at a patient from a nutritional standpoint with the skin, how do you do that?
Yeah, so I can so dermatology, we're a little obsessed with colors. So like we'll have like all of our conditions, we have different hues. So I can tell by looking at the hue of someone's skin and the dewy nature or how dry it is, like whether they're a potato chip eater or
Uh-huh.
a purple cauliflower eater, right? Because the phytochemicals, the phytonutrients, I prefer to
Hmm.
call them nutrients that you eat in your foods, whether it's a wild Alaskan salmon or beets or
Hmm.
a bright colored fruit or vegetables of all different shades, those impart the same color on your skin, which is why like the Mediterranean diet will actually increase the SPF of your skin because all of those phytonutrients that protect the plants from the sun also protect you from the sun.
Boy, like I said, we like to motivate, educate, and inspire. I'm being motivated, educated, and inspired. I did not know that about the Mediterranean diet, so I have some new literature to read and new information to bring to patients. So I find that fascinating when it comes to that. So, how about the gut? Does the gut have anything to do with the skin? Because leaky gut, intestinal permeability is all the rave today, right?
Yeah, yeah, it certainly does. So we know the gut, brain, skin axis, it's all
Mm.
connected. So an unhealthy gut is going to show on the skin, whether it's eczema or psoriasis or even acne. There's not a direct causal link. It's very, very hard to study. And then rosacea as well. We're finding that most rosacea is related to an unhealthy gut microbiome, whether it's helicobacter or something, something more something else dwelling down there. And the thing about the gut is you can't just take a probiotic and make it get better. Like there's
Mhm.
an entire approach, which I'm sure you can get into on your
Tell us,
one-on-one.
how would you approach it for a patient?
Yeah. So I kind of like Dr. Mark Hyman's approach where
Right.
he weeds, seeds, and feeds.
Hmm.
So you get rid of the bad stuff, which I'm not an expert in getting rid of the bad stuff. I'll usually send them to someone like you or a functional medicine doctor,
Right.
someone who knows how to get rid of, the stuff that's there, whether it's candida or, some bad
Right.
bacteria based on their history in a deeper dive. And then I do like megaspore probiotics, like the spore biotics,
Hmm.
if you're familiar with those.
Yes.
Yeah, I like those a lot. And then eating a healthy diet. So if you overload yourself and you just take a bunch of probiotics, but you're not feeding them, they're not going to grow. So
Right.
you have to feed, your bacteria that you want to be healthy. And basically what we're trying to do with a healthy gut is have more good guys than bad guys, right?
Right.
So we want more good guys to
Yeah, you
outweigh the
definitely
bad
want more
guys.
good guys these days, right?
Yeah.
It's interesting because in my practice, we see a lot of patients who have psoriasis. They come in with many different conditions, but they also have psoriasis. And we're always doing a couple of different tests. One of them is a food sensitivity, food intolerance test. We want to know what they should be eating, what they should be avoiding, what's causing that low grade inflammation throughout your body. Starts in the gut. We also do a simple blood test to figure out if they have leaky gut, and it works very well. The nutrition the functional medicine when it comes to a psoriatic type of a condition, eczema, and we do get great results when
What do
it
you
comes to
find?
that.
Like, what do
What's
you
that?
find? What correlations do you find with psoriasis in particular? Because we know that gluten is associated, taking some fish oil is helpful.
Yes.
Losing weight is always helpful.
Always helpful for everything. So what happens is with the food intolerance, the food sensitivity testing, I use a company, a lab that we test 180 different foods. The 180 different foods, it could be anything that's working with your biochemistry or against your biochemistry. We find that patients that eat an inflammatory diet, and it could be a Mediterranean diet, it could be components of that Mediterranean diet. And what happens is that we have to take them away, and that could be causing a low grade inflammation. From there, we'll do a wheat zoomer, it's called. We're testing for gluten, and we're testing for gliadin, non gluten grains, and we're testing for that to see if there's that, if we in fact have that intestinal permeability. Generally, between the food sensitivity and the intestinal permeability test, when we change their diet, they seem to get well pretty quickly. They can lose weight. The psoriasis goes, the skin conditions go. Very common what we're seeing. We're going to put together a research study now. Very common what we're seeing is psoriasis begins to clear up. Drinking enough water, some filtered water could really be very powerful. Something as simple as that. And of course, getting your sleep, because you should get 8 to 9 hours of restful, restorative sleep. However, that doesn't work out all the time. So we're finding out that when you have this leaky gut, and we work on the leaky gut, and you're right, it's just not about the probiotics. It's about the foods that we're eating, the amount of water that we're taking, the sleep that we're taking. Are you taking products that have glutamine and some other different types of amino acids that can help heal that gut, as Dr. Hyman says? And you know what? A lot of different types of conditions are really, taken care of when it comes to that. So, that's the way that I approach it, and we get some great results. So we're going to have to do some collaboration now on some
Oh,
patients and see if we can help them out even more.
yeah, that would be great. I mean, that's the thing about the skin. The beautiful thing about the skin is it's screaming at you. It's telling you, like, hey, something's going on inside. Please take care of me, because otherwise I'm going to keep, making you uncomfortable on the outside. So it's just a
Right.
warning of what's going on the inside. I did want to mention, though, some people think they're doing all the right things on the Mediterranean diet. And I don't want to go on a tangent too much, but it's really upsetting to me that some olive oils that are labeled as olive oils are not olive oils. So,
You're making reference to a study that was done within, I think it's the last 12 to 14 or so months, where
yeah.
they looked at the different olive oils, extra virgin olive oils, and it wasn't olive oil, right?
Right, exactly. So you think you're doing the right thing and the label's even wrong. So I think you have to do your due diligence. I'm trying to think. I remember the Costco brand actually was good. And then a couple of them at Whole Foods, the ones that are made in Italy, I think are usually safer. But I always have to check the list when I buy, because you
Yes.
just never know. Honey is the same thing. They put corn syrup if it's from China. So one reason to support the local farmers with your honey.
Always support the local farmers. A
Mhm.
block north of where I am, there's a whole local farm. I live in a semi type of a rural community,
That's
and
great.
we have a lot of local farms that we go visit in the summer, and it's nutritious and it's delicious. So it's all
Yeah.
good, and it's amazing. In the nutrition world, there's no truth in labeling. You can take a supplement, you can take, you can eat food, and it can really be so detrimental for you if you don't know where it's coming. Now, you mentioned acne. Acne is always a big problem, preteens and teens. My son's about to turn 13, hormones, skin. He plays hockey. He has acne where the helmet is and so forth. So let's spend a little time with acne, because back in the day, there was a product called, I think it was Accutane, that we all used to take.
Mhm.
And
I
it
like
probably,
it. I
is
still
it, is
like
it
it. I'm
good?
not.
Really? Okay.
Yep.
All
I
right.
I
So,
I put my kids on it, but I don't use the high doses. So it's
right.
Yeah, the high doses will, they have the liver problems. And
Yes.
what matters with that medication, it's basically super potent vitamin A, where they take out some of the liver toxicity. Because if you took that much vitamin A, you would get liver toxicity. And I'm not opposed to it. It's pretty natural as far as medications go.
Right.
Um, but I don't do the high doses we used to, where we used to really bomb someone. Because what we found is what matters for permanent clearance. So 85% of people can get clear on that medication, which now there's no name brand Accutane. It's just isotretinoin.
Hmm.
85% of people can get permanently clear if they reach like a certain amount per weight
Hmm.
of their body, and I actually like it then more than antibiotics for the most part. The problem is if a woman takes it and she gets pregnant, it messes up with cell turnover. Well, if you're pregnant, cell turnover is
Right.
important.
Right.
If you're
Sure.
going, yeah. So that it has to be regulated with monthly blood checks and monthly visits, and everybody has a special card. So it's kind of a hassle to give nowadays, but it is a good medicine. Yeah.
Because I remember in the mid 70s when I was in, I won't tell you where I was at that point, but there were multiple friends that were going and they were taking a lot of antibiotics were prescribed for acne during those times. Probably caused havoc with your gut
Yeah.
at that time. And who knew to take probiotics back then? It wasn't something that we were thinking about doing, because acne has a physical effect and it has a social emotional effect to it, right?
Yeah, exactly. And I always tell teenagers, especially if they're not compliant, because you try to keep it as simple as possible because teenagers are not usually compliant. Like my son is 13 and he'll say, Mom, I put this on my face last night and it's not better. I'm like, no, it doesn't work that way. It takes
No,
more
it
than one
doesn't.
night.
Yeah, it
It's not
doesn't.
magic. So, with the non-compliance, I'll tell them, I'll say, listen, our goal in treating your acne, especially when you see like a mother and a
Hmm.
son fighting, like about the whole situation of
Oh
using
yes.
it. So the reason we treat it is so they feel better about their skin until they outgrow it, because
Hmm.
usually because of that surge in testosterone is why acne kind of is most common during the teenage years. We have adult
Hmm.
acne, which we can talk about. And then
Hmm.
the second reason is to prevent scarring. So when you have a lot of inflamed acne on your face, what happens is the inflammation causes collagenase, which is an enzyme that breaks down collagen. You can get permanent divots in your face. So
Right.
most people don't want to have that for the rest of their life. So we want to get their acne at least 70% better so they don't have permanent scarring the rest of their life. So
So when
that's
you talk about 70% better, how do you approach this from a medical standpoint as well as from a nutritional standpoint when somebody comes into your office?
Yeah. So I'm mostly doing telemedicine now.
Hmm.
I sold my practice and I'm only doing telemedicine now on a platform called Dermatologist on Call.
Hmm.
And the good thing about that is that I'm licensed in 18 states. So I get to see people from all over the country. And I'll even see
Yes.
trends with that, like localized
Right.
trends, which are interesting. And I have a program that I put people on. I don't have the benefit of all the testing you would do in
Hmm.
your office to have a very refined, personalized plan. But what I can do is give generalized recommendations.
Hmm.
So, generalized recommendations, we know that a high glycemic load or a lot of sugar in your blood can cause acne. So,
Hmm.
I ironically, the studies in the 60s where they studied chocolate to see if chocolate caused acne,
Right.
they said, no, it doesn't. Well, what they did, have you seen these studies?
I've read the studies. Yes.
Yeah. So they basically, the placebo was sugar. So does sugar? Yeah. So the placebo was sugar, and then the other one was a chocolate bar. So yes, sugar caused acne in all patients, even the ones that had chocolate added to the
Even
sugar.
even even the ones that had chocolate. That's what we call a confounding variable, for all of you individuals that are geeky scientists that are listening to Dr. Jen and I right
Exactly.
now.
So now we know, like, dark chocolate's okay. Yay. But
Right.
sugar is not. So, the thing about our bodies is our bodies are so smart that if you have bread or potato chips, it converts it to sugar really, really quickly. So,
Yes, it does.
processed white foods will convert to sugar. And,
Mhm.
when we were talking about the skin earlier, like I could see that on someone's face if they're really dull and
Mhm.
dry skin with lots of little creases, especially an older person. Like diabetics have very different skin because their sugar levels are so high.
Yes.
So,
We're going to have you look at my skin, I think, at the end. Let's see if you can come up with, we're gonna, we'll put you on the spot.
no
Yeah.
filters.
What's that?
No filters. I don't even
No
know how to
filters,
do
right?
filters. Yeah. I don't even know how to do them, but yeah. So sugar avoidance. And then we find that dairy, ironically, skim
Yes.
milk, even more
Yes.
so. And I don't know.
Really?
Yeah, skim milk even causes more problems. So people think they're doing better. And it's not because of the like, we thought maybe it was like the sugars in the milk causing a
Mhm.
higher rush. There's something with the proteins we think that's causing
Mhm.
some sort of like insulin like growth response, but basically the milk causes a lot of inflammation. So I have
Yes.
some people who they have a lot of like red juicy cystic ones on their neck or their
Mhm.
face, and I can just tell it's the inflammation from the dairy is screaming. And sugar you can decrease, but dairy you kind of have to eliminate. It needs to be eliminated.
Right, because if you're taking in sugar, I try to monitor how much sugar, especially if it's a diabetic patient, of course.
Yeah.
Dairy. I'm finding that most people have a dairy a dairy intolerance. So we're always recommending cheeses. Oh, as an Italian American, I love my cheese.
Oh,
I had to get rid of my cheese at that one point in time. So we're finding out that dairy products, yes, they do. It causes acne and different types of skin conditions.
the dairy is the hardest. I mean, the cheese is just so hard for me. Growing up in New York, it's everything's cheese. It's the best. And I had a different presentation. I didn't have well, maybe my acne was from cheese back then, but I lost my voice 7 times in a year. And I called my friend, he's an ENT doctor. I said, "Hey, can you scope me and see if there's we used to laser off a lot of warts when we were in residency. So I
Uh-huh.
thought maybe the wart virus got into my larynx and caused
Right,
some
right.
problems." And he took a look. He goes, "No, you don't have that, but you've got pools of acid here." I said, "What? I'm not overweight. I eat really healthy. I don't wear a tight belt. I don't go to bed with a full stomach." I went through the whole list of what causes acid. And he goes, "I don't know." But of course, he puts me on a proton pump inhibitor. And, until it was stabilized, like huge doses, 40 twice a day, I think. And I eventually got off of it, obviously, because I wanted to have some calcium in my bones and not be osteoporotic. And
Absolutely.
yeah,
See,
but
see,
I have to stay away from dairy and tomatoes. I'm done. I wouldn't even have a voice right now.
tomatoes can be, very, there's allergic reactions, there's those intolerant reactions. And for our listeners today, yes, as physicians, we kind of test each other at times, and we see what's going on, and it's kind of fun. So now, what else about acne can you
Yeah. So
discuss?
absolutely. So the dairy and the sugar are big dietary things, and
Mhm.
obviously teenagers in particular, it's important for them to be around social, interactions. So it's not an
Mhm.
all or nothing thing. Whatever they can do is fine. I'll get into adults because adults, I try to hit the xenoestrogens and the
Mhm.
endocrine disruptors a little bit more.
Yeah, we'll get into that too. Yes.
Yeah, I give it to the teens as well, but I'm not as strict about it. Um, just because their body metabolizes them a little bit quicker. And then I usually will talk about some supplements. So we mentioned
Mhm.
probiotics,
Mhm.
because the skin purges, right? So
Right.
why are saunas healthy, right? Because we remove toxins from the skin through
Mhm.
sweat. Well, if you have a lot of toxins, sometimes it presents in some people as acne. And so probiotics I'll usually recommend. And I recommend avoidance of like vegetable oils and
Oh,
adding a
yes.
little bit of fish oils in to kind of
Right.
increase that omega 6, omega 3s to omega 6s. I try to keep it 2 to 1 omega 6 to omega 3. And then in Arizona, it's kind of an interesting fact. We used to mine copper in
Mhm.
Arizona. So our copper in our water is really high, and copper, zinc, and iron, they kind of compete for things with each other. So
Mhm.
having the balance is really important. And it doesn't hurt anyone to take 30 milligrams of zinc a day. So I recommend that. It also helps with immunity. And sometimes I could just clear people with a little bit of zinc around here, especially if they have a few papules around their mouth.
Yes.
Yeah. And then let me think. And then I often will recommend some meditation and breathing because we know high stress hormone can kind of mess the
Right.
whole milieu of all of the hormones. So that's really important as well. I don't care if they go for a quiet walk, do some breathing in line at the grocery store. You
Right.
know, I like Andrew Weil's 4-7-8 breath for most people. I have
Right.
some higher end stuff that I use for myself. but just breathing, like it's so simple. It doesn't cost anything and the power is within ourself, and breathing it just brings homeostasis and balance to everything.
You know what? I love that because we have somebody in the office that does do that with our patients. And, you want to bring down that sympathetic tone. You want to get that parasympathetic tone that's going on. And our listeners are savvy enough because they've been with us for a while. So they should know that, what that is. And I love that you mentioned the vegetable oils because that's really not healthy for us on any stretch of the imagination. Dr. Jen was mentioning omega-6 and omega-3 fatty acids. It should be a 2-to-1 or a 1-to-1 between the omega-3s and the omega-6s. However, in today's society, it's 15 to 20-to-1 with the omega-6s. The omega-6s, as my listeners know, it is omega-6s, pro-inflammatory, arachidonic cascade, really not the best, can get a lot of different types of skin conditions with that. So you want to go with the omega-3s, nice supplementation. If you like salmon, wild caught salmon is my favorite.
Me
No
too.
doubt about it. It's great.
It's in my refrigerator. I'm going to have it for lunch, actually.
Oh, I can't fly now to Arizona and have it. And, okay.
But let's talk about the oils, because I think a lot of times people think like, well, I'm already oily. Why am I going to have more oil in my body? I don't want to have fats.
Great topic. Yes.
Yeah. And I get that a lot. And it's really important for people to understand it's about oil balance. So if you have those inflammatory oils, like from the omega-6s, and the biggest ones are, if you start reading labels, look for canola and soy. They put it in every dressing. And I know it's painful to not spend $1.99 on dressing and have to spend $8.99 on dressing, but you're worth it. Like, you are worth it. Your body is worth it.
You are, you know what? And let me just interrupt just for 2 seconds. Listen, you guys that are out there listening, this is important because that canola and that soy is, you want to stay away from that. So yes, I totally agree with you. Right.
I know it's really upsetting because it's in everything. And I go to the store and I think I'm buying something healthy and I read the label. I'm like, gosh, this has freaking canola oil in it. Like it's cheap oils. They're subsidized, they're cheap, and they put them in everything. But all of that adds up over time and it causes some serious harm on the human body.
It does. And if you're using canola oil and if you use it at high temperatures when you're cooking, it gets even more what we say rancid. And now you're just, it's just not really good at that particular juncture. So I love this. So there's a balance with the oils.
Exactly. So the omega-6s, very, very inflammatory. So every time I say the word inflammatory, basically red. So anything on your skin that is red, or any itis, like arthritis or anything like that. So, and I could tell, like, I'm close to half a century. And if I have something the next day, I have like some joint stuff going on. I'm like, I can't cheat anymore, whereas the omega-3 fatty acids. So think of like some nuts and a cold water fish, like wild Alaskan salmon is the greatest because it also has something called astaxanthin that adds a nice little ruddy color to your skin. And it's protective. It's an amazing antioxidant.
I love that. Yeah.
Yeah. Like the farmed salmon, the Atlantic farmed salmon. No. That they add pink dye to that and feed it disgusting food. And you're not getting what you want.
You're not getting what you want. And they're living in a toxic environment to begin with. It's a whole toxic situation. So, you want to stay away from those farm raised fish, because about 12 years ago, tilapia was all the rave, right? Everybody wanted to eat tilapia, great source of protein, but it was all farm raised fish.
Right. Yeah, I know. I had a bad experience with tilapia. So I used to do fitness competitions, NPC, like competitive fitness competitions. And your meals are so restricted. And I had cold tilapia, and I still, when you say the word tilapia, the taste of cold, old tilapia
just comes
in my mouth.
All right. So you pediatrician, dermatologist, United States Navy, VIP. Now I'm in fitness competitions. Tell us about fitness competitions.
Yeah.
Where did this all fit in?
I just like to have hobbies and challenges. So like when I've lived in San Diego, everybody runs marathons. So I ran a couple marathons, and I usually do 2 because you never know if the first experience is going to be good. So you have to check it out again.
Right. Sure.
And, and then about 5 years ago, I was working out with my trainer. I've always worked out. I like to do exercise. And she recommended that I try it. And I said, sure, I need a new challenge. So I'll do it. And that's when I started writing for FitnessRx magazine, because I
Mhm.
realized like the whole industry cares so much about their skin. I mean, they care so much about their looks, but there's no knowledge or information about
Right,
skin.
right.
So, and everyone was breaking out in line. And I think it was a combination, like when we're in line to go on the stage, everybody's breaking out and having a lot of acne. And I'm like, they have clean diets. So I think a lot of it is whey and protein from the milk
Uh-huh.
solids and the protein powders. And then
Yes.
like the cortisol imbalance from the stress. So it made me realize like diet isn't the whole picture. There's other little things that can cause breakouts, So,
Yeah,
um,
definitely other things that can create those nuances, because I remember when I was in high school, I didn't have acne bad, but during football, from the helmet and the shoulder pads, you would always break out. But there was always a couple of our buddies that, were really bad, washing their face between class because that's what you were told to do. There
yeah.
was a certain soap that they would use. I forgot what it was. It was in a green tube now that I'm remembering. Phosphor.
I remember that one. I had that one. I forgot
Did
what
you
it's
have
called. I think it's just PhosphoClean or something like that, or it's PhosphoCleanse.
phosphoderm or something like
I
that?
think so.
I
Gosh,
think it was phosphoderm, right? That was a
I
long
forgot
time ago.
about that. I don't even know what's in
Yes.
it. I should look it up.
Yeah, I
But
think I think what was in it was a lot of chemicals to
chemicals
to dry your skin out and so forth. So
syrup, the
so
skin. Yeah.
anything about acne that we should know?
Yeah. So with the occlusive acne, like with athletes, I like to use salicylic acid in like a toner or a pad after sports to kind of help unplug those pores that were
Right.
occluded the whole time. And there's a company called Topics that makes some like spray for the back and stuff. And you can find it on Amazon. It's just like
Hmm.
salicylic acid over the counter. And that's kind of a nice, quick little thing to do instead of going and washing your face after sports. You can just do it lightly with the cotton swab. And then for adult acne, which we see a lot of. So when I trained, I was the only female. So all the female patients with adult acne wanted to see me. So I got really good at
Hmm.
treating female adult acne because they thought the woman would understand better. Right. And I don't know why, because I wasn't dealing with it, but of course I did I was empathetic, obviously. And I asked the head of the department in San Diego, I said, hey, this is crazy. Why are we seeing so many women in their 40s, their 30s, and their 40s with acne? And was this happening like 30 years ago when you were my age? And he's like, no, we weren't. So I kind of was clued in then just by looking at patterns. I do pattern recognition for a living, and I
Hmm.
realized the patterns were off. So there had to be something environmental, which we now are more clear on, not
Hmm.
100% clear, but we know that we're kind of poisoning our environment. So with female hormonal acne, typically what we will see is around the jaw and the chin, we see really juicy, inflamed papules, like bumps,
Right.
basically. And when they last forever, they feel a little painful. They last forever, like a month. They don't last a week like normal acne. And when they go away, they leave a lot of discoloration. And you can't pick them. People try to pick them. You get nothing out of them. There's no pus in there. They're very deep inflammatory.
Right.
And it's from hormonal imbalance. So I'll often recommend, do you use a supplement called DIM, indole 3 carbamate or DIM
Yes,
often?
absolutely.
Yeah.
Yes.
Yeah. So, I mean, obviously, there's a lot of detoxification sometimes of these abnormal estrogens that needs to be done. And you need to get a full workup, like something you would do in the office. But sometimes I'll recommend that. I recommend the other supplements we talked about. And then I talk about endocrine disruptors and things that they should avoid.
Important
Everything from,
topic. Yes.
everything from the receipts,
Yes.
when you get the receipts at the grocery store,
Uh-huh.
and now with the hand sanitizer on your hand, it's absorbed that much more. So I just say, no, thank you. I'm good. I trust you.
Right. Yeah. I mean, these endocrine, disruptors are all over. Toxins and in your foods, on your foods. It's just causes a whole host of things. We could probably have another podcast on that alone, right?
I
Endocrine
know. But
disruptors.
quick things people can do is like, don't use plastic bottles when you drink. Just use like, I think this is a hydro flask. I'm not good with the glass ones, but glass or stainless steel, you can carry them everywhere. You're helping the environment, and you're
Yes,
definitely helping
stainless
yourself.
steel. Yes, we have a bunch in the house. So when we drink a lot of water, we put a little lemon in it. We have the stainless steel, or we have the glass. And I just finished one a big one like this just before
Yeah.
we decided to come on air today. So yeah, so that is very important. Now, winter's coming up. Oh boy, my skin gets really dry.
Hmm.
What can we do? What is this all about?
Um, Number one, we use too much soap.
Yeah,
So before we start throwing medications and more chemicals on your body, I recommend minimizing the amount of soap that somebody uses. So
interesting.
it's really you see the commercials where people are lathering all over their
Oh
body
yeah.
and suds are going everywhere. Well, those suds, what they do when that surfactant goes on the skin,
Hmm.
basically the way soap works is it has an ingredient, a chemical that is attracted to oil because oil usually holds on to dirt, right?
Hmm.
And then it pulls the oil out with the dirt with it. Well, when you don't really have any oil on your skin, it's just pulling out the minimal amount of oil that you already have on your skin. Now,
Uh-huh.
you need to have a protective skin barrier so your skin holds together. And
Hmm.
these little desmosomes, they hold together like bricks and mortar. And when you break out that mortar, basically the bricks kind of start falling apart. And that's where you get cracks in your skin. And
Hmm.
then you're prone to eczema and dermatitis and all the other things we see. So I usually say something mild. I like Cetaphil Restoraderm or CeraVe, a
Hmm.
mild soap or cleanser that doesn't suds. It will still clean your under your arms, your groin, your feet.
Hmm.
Everywhere else is you're good with just water and friction. Unless you're working with motor oil or acrylic oil or some sort of oil, but just regular sweat and dirt, you're not going to smell.
Right.
So that's step number one. And then step number two, I recommend a ceramide moisturizing cream, not a lotion, but a cream.
Hmm.
A lotion usually has alcohol in it and it will evaporate.
Hmm.
And then that's why you're dry a few hours later. So I recommend a moisturizing cream. As soon as you get out of the shower, just dab your skin dry and then apply it head to toe and just kind of stand there while it gets
Right.
absorbed. And I like a company called Epicurean. They're used in spas, and it's just coconut. It's like coconut oil that's a
Hmm.
lot more elegant than what you would buy at the store, And they put it in a moisturizing lotions, but it's very very clean. And then I like CeraVe or Cetaphil as well, and in a cream.
Hmm.
Those are fine too, and they're very well tolerated and they're accessible to everyone. Um, and then I think fish oil is really important, and I just make sure
Yes.
people are getting enough vitamin D, especially this time of year. I recommend 5,000 for everyone of vitamin D.
5,000 with K1 is always our
Always.
recommendation. That's
Yeah,
always what we do. Yes. And when you were
exactly.
talking about, I remember uh, back in the 70s, Safeguard soap and Dial soap were always
Yeah.
going at it. And there was always somebody in the shower and they were going and it had like 5 inches of
Yes.
lather of soap. And that was supposed to make you feel good, right? That was supposed to make you cleaner from what I remember. And
Exactly.
but all those chemicals in there wasn't exactly the best for us.
Exactly. Some people will benefit from a humidifier.
Hmm.
Out west where the water is dry, I recommend a water softener. I don't think you have those problems there so much. And what was the other thing? Oh, for the face. So, like, just say you have a female patient who has a really good skincare regimen and they're drier in the winter. What I
Hmm.
have them do is get like a hyaluronic acid because hyaluronic acid draws in 1,000 or 1,500 times its water weight. And I just
Hmm.
have them use their regular moisturizer and then add a pump or two of hyaluronic acid and add that on the skin, like when it's
Right,
still a
right.
little dewy and moist, and it kind of seals in the moisture without adding oil. So it's good for acne prone skin too. That might be a little dry because hyaluronic acid is oil free.
Yes.
So yeah,
Interesting. I love that. We're almost up on our hour, believe it or not. We're just rocking here. And I
covered a
feel
lot.
like yeah, I feel like we're just, warming up a little bit here, So any other tips on winter skin that you can give us?
No, that's really a good start. I just think making sure you use a moisturizing cream rather than a lotion is a big thing that I see. And if something's itchy, try not to scratch it because it sets up this horrible cycle,
It gets
of
that vicious
itching and
cycle
scratching.
going
Yeah.
on and you're scratching it and you're itching it. And I don't know, when I have dry skin, I like to go like this
Itching will make
and
you crazy. And then
it's,
sometimes materials can make you more itchy. So avoid those materials. Go for softer, more organic kind of,
and
natural
what
materials.
about when you're washing your clothes? That could be a problem too, right? With dry skin, depending upon what detergent you're using.
Yeah. I just do the free and clears. I
Right.
use all or Tide free and clear, whatever's the cheapest. I just do the free and clear or the chemical free and the fragrance free. I mean, it's better for the environment too. And that comes back to us anyway, you know?
Yes. So let's talk a little bit about dry skin and eczema. What is eczema? What is dry skin? What
Yeah. So
happens there?
well, eczema is a term that we like to throw out there. It's basically like a dermatitis or inflammation of the skin. And there's a lot of different things
Right.
that could be grouped into that. But traditional atopic dermatitis or eczema, it's more common in children and it improves over our lifetime and it can wax and
Right.
wane and you can get it in certain areas. And it's basically dryness of the skin with a compromised skin barrier
Hmm.
and an allergy of the skin. Okay. So it's more common in people with asthma and seasonal allergies as well. So it's important to try to avoid contact with whatever allergens it is, and then
Hmm.
rebuild your skin barrier with what we just talked about. Because if your
Right.
skin barrier is intact, it if this the skin is amazing because it protects you from infection, dehydration,
Right.
toxins from the outside world. So as long as it's sealed, you're in good shape. And that's what we're seeing with, people overwashing their hands now and maskne is like the skin barrier is getting so compromised that we're getting all of these other problems. So I hate those hand sanitizers with alcohol. They just tear up the skin. It's taking up half my my life.
And right now, with COVID, especially here in the Northeast, everybody's walking. Dr. Jen, everybody's walking around with hand sanitizers. I mean, there are offices you can go into a insurance office, or you can go see your accountant, or you go see anybody,
Yeah.
and they have them. They're like, here. It's like the new marketing tool to have your name, and everybody's going like this.
I know.
When
I
it
know.
comes to that,
Just don't touch your hands to your face. You'll be good. Like
it's
really just wash your hands before you touch them to your face. And other than that, they could, stay out there, but it's just going to tear up the skin. And, for dry hands, just say your hands are compromised. I like white cotton gloves that you can
Mhm.
get. We're all struggling with our hands right now.
Right.
White cotton gloves. And I get like, a set of 10 of them. You can buy them online or, at the local drugstore. And I have people put like, let's think of one over the counter. There's Theraplex is a company
Hmm.
that makes some. They make some healing salves, and then even CeraVe has, or I don't know if Cetaphil or CeraVe, one of those two. They have like a moisturizing ointment, and I have people coat, wet your hands at night and then take the ointment. It's like a thick Vaseline, and
Hmm.
put it on your hands and cover it up with the white cotton gloves, and then try to do that for one more hour in the day, and just to rebuild that skin barrier because I mean, to be honest with you, if your skin barrier is broken down from all these harsh soaps and hand sanitizers, you're going to be more prone to infection. So it's
That was
catch
that was
22.
yeah, that was my next question. Link
Yeah.
between we're in the middle of a COVID pandemic, cold and flu season here in the Northeast at the very least. There's an uptick in the COVID, so skin's very important, plays a vital role with that.
Yeah, here too. It's important to well, and then the other thing is like your skin is also like there's been some people that I've diagnosed that have no symptoms of COVID just by
Hmm.
skin, like the COVID toes and stuff. Back in March, I was seeing that, and healthy 20 something year olds. So there's other skin manifestations that can come on your skin that can be a manifestation of having COVID without,
Right.
yeah.
So, is there anything else that you want to tell our audience before we go off today? Is there any other? Because this has been a fascinating conversation. I can go for hours more. I
Super
feel like,
fun.
yeah, I feel like we're just scratching the surface. So,
Yeah.
we're going to look to have you back on after the holidays. I just think there's just so much that we can talk about when it comes to this. So, is there anything else that you want to give us some clinical pearls for the skin?
The only thing I would recommend, I would just emphasize that exercise is really important. So you have to think about your skin as like this organ that represents what all the other organs are doing, right? So you have to have good blood flow to your skin because
Hmm.
the blood is going to deliver all the nutrients that you're going to recommend for your patients
Hmm.
and take out all of the toxins and deliver oxygen, clean out the garbage, right?
Hmm.
So having good blood flow through exercise and maybe some high that might raise your nitric oxide level, like beets
Hmm.
or arugula, I think are
Hmm.
really important as well. Yeah, so it's just really a whole approach from mind, body, spirit. The
Right. I love that. I think that's the best approach, and
Hmm.
we're finding out that's the best approach today.
Yeah.
So it's all good. So tell us, if somebody's interested in doing a telehealth consultation, how can they contact you?
So I work through a platform called Dermatologist on Call. They can just go to dermatologistoncall.com. And if I'm licensed in their state, I can see them. They can select me. And if I'm not, they'll see another board certified dermatologist. Um, and then I'm on Instagram at Dr. Jen Haley. I think
Mm-hmm.
we connected today.
Yep.
And yeah, that's probably the best way. And I'm starting a podcast. I'm going to be launching it on Monday called Radiance Revealed. So we'll be talking about some of these
Radiance revealed. I love that. Oh, so get your guest list going. Get me on there. We'll do
I'd
gut
love to.
health, or we'll do gut health and skin, or whatever you want to talk about. And
That
we'll
sounds
and
perfect.
yeah, and we'll
Gut
and
health
we'll
and skin.
gut health and skin. I could talk for hours about gut health.
Sold.
That's what I do all day long. So everybody, dermatologist on call, recommend Dr. Jen. Give her a call, see if she can help you out. Want to thank everybody for listening in today. Our podcast is growing. We thank you from the bottom of our heart. We have really fabulous guests. I mean, Dr. Jen, we're not going to get any better. So, Dr. Jen, thank you very much for being on today.
Thanks for having me. That was so fun. I had
We
a
had a
great
good
time.
time.
Thanks, Dan. Yeah, super fun.
Yes. So, Suburban Wellness Group, we are located in Newark, New Jersey, 973-483-2277, or go to our website, suburbanwellnessgroup.com. Want to thank everybody for listening. Thank you again, Dr. Jen, and we will see all the next time. Take care now. Have a great week.